Suppose I told you that the achy, puffy, weary sensation in your lower limbs after 60 isn't merely standard aging, and that overlooking it could stealthily rob you of your self-reliance one evening at a time. If your legs feel achy, puffy, or weary by the late afternoon, particularly once you've passed 60, many individuals assume this is simply how growing old works. They think sluggish flow is something you must tolerate, like wrinkles or slower mornings, but here's what frequently surprises older patients when a doctor explains it to them in simple words. In numerous instances, the issue is not your heart, and it is not your blood vessels alone. It is a tiny cluster of muscles in your lower legs that have quietly stopped performing their job. One orthopedic and vascular concept has been talked about for years in medical education. Your calf muscles operate like a secondary pump for your legs. Each time they squeeze, they assist in pushing blood upward toward your heart. When they weaken, blood tends to gather around the ankles and lower legs. This explains why puffiness, soreness, and that heavy feeling often appear together. In a study published in the Journal of Applied Physiology in 2021, researchers followed seniors with mild flow issues and discovered that focused calf muscle engagement notably enhanced venous blood return over only a few weeks. The participants were not sprinting, and they were not performing exhausting workouts. They were doing one extremely simple action that most people miss because it looks too easy to be meaningful. This does not imply walking is harmful for you. Walking is wonderful for overall wellness, but walking by itself does not always give these muscles the distinct signal they require, especially after 60. That is why many physicians quietly suggest adding one specific motion to support leg flow and reduce everyday discomfort. In this video, I will guide you through that single motion, starting gently and safely exactly as it is often taught to older adults. If you remain with me, you will understand why this one action can make your legs feel airier and more comfortable again without gear and without effort. Before we start, if you haven't subscribed yet, I suggest you press that button and activate the bell so you never miss another wellness tip made just for you. If you appreciate this video, type 1 in the comments. If not, type 0 to let me know how I can create better material for you. Motion number 5, gentle seated calf engagement. This is the exercise many physicians begin with when an older patient complains about heavy legs, ankle puffiness, or that tired feeling that appears by the end of the day. It looks almost too easy, which is why most people never imagine it could be significant. But this tiny movement targets a muscle system that plays an essential role in leg flow after 60. This motion is performed sitting in a chair with your feet flat on the ground. There is no standing, no balance difficulty, and no pressure on your knees or hips. What you are doing is softly raising your heels while keeping the balls of your feet on the floor. When you do this, the calf muscles tighten and loosen in a controlled manner. These muscles are sometimes called the venous pump of the legs because their squeeze helps push blood upward against gravity. In daily life, this matters more than most people realize. When the calf muscles are weak or inactive, blood can gather in the lower legs. This contributes to puffiness, pressure, soreness, and that heavy feeling many seniors describe. Strengthening and reactivating these muscles helps support flow during lengthy periods of sitting, watching television, or traveling in a car. A study published in the Journal of Applied Physiology followed older adults with mild flow issues and discovered that focused calf muscle engagement notably enhanced venous blood return over several weeks. The participants were not doing intense exercise. They were using simple seated movements that sent a clear signal to the muscles responsible for assisting blood flow. To practice this safely, sit straight in a firm chair. Place both feet flat on the floor about hip width apart. Slowly raise your heels as high as you comfortably can while keeping your toes down. Pause for a moment at the top, then lower your heels back to the floor with control. Move gently and breathe usually. If you feel any cramping, lessen the height of the lift or take a short rest. A common error is speeding through the motion. Velocity is not the aim here. Gentle, controlled repeats are far more effective for flow than fast bouncing. Another error is holding your breath, which can reduce the benefit and make you feel dizzy. For older adults, this motion supports comfort, confidence, and self-reliance. It can be done every day, even multiple times daily, without exhaustion. Many people notice that their legs feel airier and less tight within a few weeks of steady practice. This gentle engagement prepares your legs for the next step, where we start to add stability and strength in a safe, supported way. Motion number 4, supported ankle to knee glide after the calf muscles start waking up. The next step is to help blood move more freely through the joints that sit just above them. This gentle movement focuses on the ankles and knees working together, which is vital for smoother flow in the lower legs as we age. This motion is still performed seated, which keeps it safe and easy. You sit in a chair with your feet flat on the floor. One leg at a time, you slowly slide your foot backward toward the chair, bending the knee. Then gently slide it forward again until the leg is nearly straight. The motion is slow and controlled, more like guiding the joint than forcing it. As the knee bends and straightens, the surrounding muscles softly contract and relax, helping blood continue its upward journey. In daily life, this matters because many older adults spend long periods with their knees barely moving, especially when seated. Limited knee motion can slow flow and contribute to stiffness and puffiness below the joint. By restoring this natural bending and straightening pattern, you help keep fluid from settling in the lower legs. Research summarized by the Cleveland Clinic has shown that gentle, repeated joint movement improves venous return and reduces stiffness in older adults, especially when combined with muscle engagement below the knee. The key is not force, but regular, comfortable motion that keeps the joints and surrounding tissues active. To practice, sit upright and place both hands on the sides of the chair for support. Slowly slide one foot back, bending the knee as far as feels comfortable. Pause briefly, then slide the foot forward again. Switch legs and repeat. Breathe normally and keep the movement smooth. If you feel knee discomfort, reduce the range and focus on a smaller, pain-free motion. A common error is pushing the knee too far or moving too fast. This motion should feel calming, not demanding. Think of it as greasing a hinge rather than testing its strength. For seniors, this movement supports comfort and confidence when standing up, walking, or climbing stairs. It builds on the flow benefits of the first exercise and prepares your legs for the next stage where balance and stability start to play a larger role. Motion number 3, supported standing weight transfer. Once flow has been gently encouraged through the calves, ankles, and knees, the next step is to help your legs relearn how to manage body weight safely. This movement introduces standing in a controlled way without forcing balance or strength beyond what feels comfortable. For this exercise, you stand behind a firm chair or near a kitchen counter, keeping your hands lightly resting on the support. Your feet stay about hip width apart. Slowly, you shift your weight slightly onto one leg, then gently back toward the center, and then toward the other leg. The movement is subtle and quiet. You are not lifting your feet or testing how long you can balance. You are simply teaching your legs and hips to share the load smoothly. In everyday life, this weight-shifting ability is vital. Every step you take, every time you turn or adjust your stance. Your body must transfer weight from one leg to the other. When this process becomes hesitant or uneven, flow can slow and the risk of stiffness or discomfort increases, especially after lengthy periods of sitting. Guidance from the Mayo Clinic emphasizes that supported standing movements improve lower limb flow and neuromuscular coordination in older adults, particularly when balance confidence has declined. These gentle shifts help muscles contract rhythmically, encouraging blood flow without the strain of full exercise routines. To practice, stand tall with your chest relaxed and your gaze forward. Shift your weight slightly to the right, feeling the pressure through your foot. Then return to center. Shift to the left and return again. Keep the movement slow and steady, breathing naturally. If you ever feel unsteady, reduce the size of the shift or bring more weight back through your hands. A common error is locking the knees or leaning the upper body too far. The aim is quiet control, not range or speed. Think of your weight moving like a pendulum, smooth and predictable. For older adults, this motion supports balance, flow, and confidence while standing. It builds on the earlier seated movements and helps your legs get ready for more functional real-life movements in the next step. Motion number 2, chair-assisted sit to stand, after your legs have been gently reactivated and your balance has been reintroduced. The next step is to strengthen flow through a movement that closely matches real life. This exercise focuses on standing up from a chair with control, which is one of the most important actions for both leg strength and healthy blood flow after 60. This movement starts seated in a firm chair. Your feet are flat on the floor, slightly behind your knees. From here, you lean forward just enough to bring your weight over your feet, then slowly rise to a standing position. Once standing, you pause briefly, then sit back down with the same calm control. Your hands can rest on the armrests or on your thighs if you need extra support. In daily life, standing up from a chair happens dozens of times daily. Each time you do it, large muscles in your thighs, hips, and calves contract together. This coordinated contraction is powerful for flow because it pushes blood upward through the legs while also building functional strength. When this movement becomes difficult, people tend to avoid it, which can worsen both weakness and flow problems. Information shared by Harvard Health Publishing explains that sit-to-stand movements improve lower body muscle engagement and support venous blood flow in older adults when performed slowly and consistently. The emphasis is on control rather than speed, especially for those with joint concerns. To practice safely, start with just a few repeats. Stand up slowly, taking about 3 seconds to rise. Then sit down even more slowly. Breathe normally and avoid holding your breath. If your knees feel uncomfortable, reduce the depth or use your hands more for support until strength improves. A common error is dropping quickly back into the chair. This removes much of the benefit and strains the joints. Moving slowly keeps the muscles engaged longer, which is better for flow and confidence. For seniors, this motion supports self-reliance, reduces reliance on help, and helps legs feel more active throughout the day. It prepares your body for the final exercise where flow, strength, and daily movement come together in the most meaningful way. Motion number 1, controlled heel to stand glide. This is the exercise many clinicians quietly consider the most valuable for leg flow after 60, not because it is hard, but because it combines everything your legs need in daily life. It brings together calf engagement, weight transfer, and standing strength in one smooth, practical movement. This motion starts from a standing position with your hands lightly resting on a chair or counter for safety. Your feet are hip-width apart. You start by slowly raising your heels just a little, feeling the calves engage, then gently lowering them back down. From there, you bend your knees slightly and straighten again, as if beginning to sit, but choosing to stand tall instead. The movement flows calmly from heel lift to gentle stand, then back to a relaxed standing position. In everyday life, this pattern is incredibly important. When you rise from a chair, step forward, or adjust your stance, your calves, thighs, and hips must work together. This coordinated action helps push blood upward through the legs while also reinforcing the strength needed to stay independent. Many flow problems worsen simply because these muscles stop working together. Guidance from the National Institutes of Health highlights that combined lower body muscle engagement improves venous return and functional mobility in older adults more effectively than isolated movements alone. When multiple leg muscles contract in a controlled sequence, flow support becomes stronger and more consistent throughout the day. To practice, stand tall and relaxed. Raise your heels slowly, pause briefly, then lower them. Next, bend your knees just a little and straighten again. Keep the movement smooth and unhurried, breathing naturally. Start with a small range of motion and increase only if it feels comfortable. If you ever feel unsteady, rely more on your hands or reduce the depth of the bend. A common error is rushing or turning this into a squat. This is not about pushing yourself, it is about steady, confident movement that your body recognizes and can repeat daily. For older adults, this motion supports flow, balance, and self-reliance all at once. If you were to choose only one movement to help your legs feel airier and stronger after 60, this is the one many professionals recommend building into your routine. Bonus: seated ankle circle glide. And now, as a special bonus, here is one more movement that many people overlook entirely, but that can make a real difference, especially on days when you do not feel like standing at all. This is the seated ankle circle glide, and it is as gentle as it sounds. You can do it first thing in the morning before you even get out of bed, or any time you have been sitting still for a long stretch. Here is why it matters. Your ankles are the lowest major joint in your body. When they stay stiff and still, blood and fluid have a harder time moving back up through the legs. Even small controlled ankle movements stimulate flow in the feet and lower legs, the area where pooling tends to start first. This exercise is done entirely seated. Sit comfortably in your chair with both feet lifted slightly off the floor just a few inches. Then slowly rotate one foot in a wide, smooth circle. Go in one direction for several rotations, then reverse. Switch to the other foot and repeat. Keep the circle slow and deliberate as if you are drawing with your toes. Breathe normally throughout. Research from the American Heart Association has noted that gentle foot and ankle movement during prolonged sitting helps reduce fluid buildup in the lower extremities and supports healthy venous return. It is a simple habit, but one that adds up over the course of a day. To practice, lift one foot gently off the floor and rotate the ankle in a full circle, 5 times clockwise, 5 times counterclockwise. Then switch feet. That is one full set. You can repeat this 2 or 3 times throughout the day without any fatigue at all. A common error is making the circles too small or too fast. Bigger, slower circles recruit more of the surrounding tissue and do a better job of encouraging blood to move. Another error is tensing up the rest of your body. Keep your shoulders relaxed and your breathing easy. For older adults, this bonus movement is especially useful during long car rides, flights, or any situation where getting up is not an option. It is something you can do quietly without drawing any attention while still taking care of your legs. Think of it as your secret tool for staying comfortable wherever you are. Ending, over the last few minutes, you have seen how leg flow after 60 does not depend on pushing harder or doing complicated workouts. It begins with gently waking up the muscles that help blood move. Then, slowly restoring motion through the joints, learning to share body weight with confidence, and finally bringing everything together in a calm, practical standing movement. Each step builds on the one before it, just like the body prefers. When these movements are practiced consistently day after day, many older adults notice that their legs feel airier, less tight, and more dependable. Standing up becomes easier. Sitting for long periods feels less uncomfortable. Walking feels more confident, not because you forced your body, but because you reminded it how to work as a whole. Flow improves not through force, but through clarity and repetition. The long-term benefit goes beyond comfort. Supporting leg flow helps protect balance, reduces the fear of falling, and preserves the ability to move independently. These are not small things. They are what allow you to stay active in your own home, enjoy time with family, and move through daily life without constantly worrying about your legs holding you back. Aging does not mean giving up control. It means choosing movements that respect where your body is today while still encouraging it to adapt. Small, thoughtful practices like these can quietly support your health for years to come. Now, I would love to hear from you. Which part of leg discomfort affects you the most right now? Heaviness, puffiness, or fatigue? Leave a comment with your age and where you are watching from. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.